Hello, vertebral column. This is where we are. What do we say about the vertebral column? So it sits, there it is, extends from your skull, and there are 26. And they are reinforced by ligaments, obviously. They're flexible and curved. And there's a big, not big, there is a hole in the middle of all of them that we'll look at, and through which your spinal cord runs through. So it has a couple of jobs. It supports your head, right? And it attaches to your arms and legs, and or your hips. And also it protects the spinal cord. That's its job. Slide 2. Okay. Before you're born, you actually have 33 vertebrae, and 9 of them fuse together to form the coccyx and the sacrum. So the coccyx, this is the bottom 4. This is your tailbone, so we could write that in there if you want. You can add that to your notes. The coccyx is your tailbone. And then your sacrum are the wide vertebra above your coccyx, below your lumbar. Okay, next slide. Let's see. Intervertebral discs made of fibrocartilage, pads, kind of like bursa, only they're made of fibrocartilage, which is, I think, tougher. And they, of course, are the cushions between your vertebra. They absorb shock. And what happens, the reason you get shorter as you get old is because the water content decreases. And so the discs shrink a little bit, and so you actually do get shorter because your discs shrink a little. But your discs are 90% water until you get old. Okay, next slide. Okay, the next bullet point that you have is each vertebra is given a name according to its, and that's this bullet point right here. So the answer to that question is location. You're going to go now to your picture, the big picture, so in the back of your packets of the spine. And I have page 25 on mine in your notes, but this page is not numbered for you. So while you're labeling, I'll talk. So this normal curvature idea here, it just means like a natural. So normal sort of means natural. Oh, that's a funny way to spell natural. Natural. Based on the way that we walk. And that actually involves 2 kinds of curves, concave and convex. And so if you notice, oops, I'm going to erase that. I don't want that. I just want this. That's what I want. The cervical curvature is concave, so it goes like this, right? There are 7 of them, and so they're called C1 through C7. C1 through C7. You have special names for your very first vertebra and your second vertebra. The first cervical vertebra, C1, is called the atlas, and that's because Atlas held up the world, right? Do you remember that Greek mythology? So the atlas, because Atlas held up the world, which is, of course, your head, and then your second cervical vertebra is called the axis, and the axis is the one which the atlas and your head rotate on. So the first one actually just holds the head, and the second one is what allows the first one to rotate. Not all the way around. We're not owls. So the atlas and the axis. C1 is the atlas, C2 is the axis. Right, so that's 1 through 7. And then your thoracic curvature is convex. So now we're going this way, okay? And there are 12 of them, and they are called T1 through T12. You are also labeling here. This is a little hard to see. It looks like a little dot. Maybe I will try to make it bigger. Yes, okay, so see how this is like a little dot right here. It's here too, and here too, and here too. And that's actually not a dot, that's a spine. And it's so it's called a process. And it's called a transverse process because it comes out to the sides. And there's one on each side, and those are called your transverse process, okay? And bring that back in. And then you also have this process that sticks out behind, and that's called your spinous process. So when you feel the vertebra in your spine, these are what you're feeling. You're feeling the spinous processes. And the spinous processes really are the attachment points for various muscles and ligaments that attach. Okay. You're also labeling down here in the thoracic section the intervertebral disc. Intervertebral, between vertebra, that's the disc right there. There is this called the intervertebral foramen, and I'm going to enlarge that again so we can look at it a little closer. So if you look, so here's one disc here, and it comes out, it's hard to see because like right here, hold on, right here, it's like a joint. Here's another joint. This one's a little easier to see. This is a joint, right? So this is literally a joint. The inferior part of the top vertebra and the superior part of the lower vertebra, right? And the connection of these two vertebrae here, then this is the body, this is the part that holds up your weight. There's this hole, and that's called the intervertebral foramen. Right, this thing right here, intervertebral foramen. And there are various nerves and blood vessels that go through here in a transverse direction. So that's what that's for. Okay, and then down here at the bottom we have your lumbar curvature, and that is again concave, okay? And this is your L1, your first lumbar vertebra, as it starts to curve around again. There are 5 of them, L1 through L5. And below that, you have your sacrum, which now is convex again. Your coccyx is, I don't think it's considered convex, it's too small to do that below that. So your sacrum, when you're an infant, these are not fused yet, or when you're, I guess, in the fetal stage before you're an infant, these are not fused, but they fuse pretty quickly. This part right here is the articulation point for your hip. So that's where your hip bone attaches to your spine, and that's another joint right there. Your coccyx is your last 4 small, very small vertebra, and they're fused too. And yeah, so once you finish labeling that, we're going to go back to the notes and talk about herniated discs. Okay, next slide. Okay, so a herniated disc, this is the next thing in your notes, back to page 14, herniated disc. And this is also called a slip disc. So it's where your intervertebral discs slip out of place, of course, right? And things that cause this or predispose you two herniated discs are, if you're old, then they're dry. If you're dehydrated, they can dry out. If your ligaments are weak from overstretching or from an accident, that can predispose you too, because it's not, your supporting ligaments and your supporting cushions are not working properly, okay? The reason it could hurt a lot is because the disc itself, because it's squished out of place, can press on your spinal cord or on your spinal nerves, which come out of that intervertebral foramen. And when your nerves are pressed on, it can cause pain or just numbness. Okay, let's go on to curvatures. Next slide. Sorry. So this is kind of fascinating. When we're born, we don't have the kind of curvature that we have when we're adults. We actually are just, our vertebrae are just curved like this. This is called a primary curvature. So as an infant, as a fetus, your spine is basically in this shape right here. And these spinal processes, the spinous processes, are separated a lot. And then those are called primary curvatures, okay? So, and then if you notice, like this one, your thoracic, it stays like that. And your sacral, so your sacrum, which is right here, also stays like that. This is the same curvature that you have your whole life, okay? But then you gain secondary curvatures. Your cervical curvature starts to appear when you start crawling. So, right, here's how your curvature is changing. You start raising your head. You learn, again, gain the muscles to raise your head. And there's also that, like, transitioning of not only the muscles, but your spine to raise your head and change this curvature in your cervical vertebra. And then when you begin to walk, that's when your lumbar curvature will begin to develop. Kind of interesting. Okay, so those are all part of forming what we call a normal curvature. Abnormal curvatures happen, that's the next slide. Typically, they can be genetic. They can come with old age. A lot of them come with old age, except scoliosis. And scoliosis is an abnormality of childhood, and it's usually genetic. So kyphosis, which is the first one, is a humpback. So that's an exaggeration of your thoracic spine, usually. Lordosis is called the sway back, and that's something horses get because they're quadrupeds. And this is an exaggeration in your lumbar. And then scoliosis is a sideways curve. So you see those pictures there. I'm gonna go to them here. So here we go. Kyphosis, lordosis, scoliosis. Abnormal curvatures. Okay, next slide. We're going to talk now about the structure of each vertebral bone. So this is an irregular bone, right? And we're going to look at the parts of the bone. And you don't have any notes, so you can just watch. And then we'll go to the picture. So there's the body, which is the weight-bearing part. That's the biggest part. And that is the anterior front of the vertebra. There's a vertebral arch, which is formed from posterior extensions. I'll show you that in a minute. There's the hole, the big hole, the vertebral foramen, not the intervertebral foramen, but the vertebral foramen. That's the one that goes down the middle. It's formed in each vertebra, and your spinal cord passes through that. The spinous process is the one that comes out the back, the one that you can feel when you run your hand down your spine. And then you have articular processes. So this is what I was showing you before. So those points where the two bones, the two vertebrae, come together, and you have one on the top, a superior one that then the vertebra above it rests on, and an inferior one that it rests on the lower vertebra. So let's look at the picture and we'll fill those in on the next slide. Here it is. Okay. The body. This is the body. So this is what it's sitting on. It's hard to see. Okay, so this is looking down. We're looking down on a typical vertebra, and the reason I know that is because what I'm seeing here are the superior articular processes. You cannot see the inferior articular processes here because they're underneath. So this is the body, so I'm looking down on, this is probably a thoracic because of its size, and we're going to look at differences in vertebra between cervical, thoracic, lumbar. This is called the pedicle, so that's what the processes come out of the body on. Superior articular cartilage, I'm looking, so this is where the vertebra above would sit on. Here are your transverse processes. Here's your spinous process. Those we want to know. This one here, you have an arch here and you have an arch here, and that's not so important because it's just the part of the structure. It's nothing attaches to it. This thing right here, the lamina, we don't need to know about that either. So cross that one off, and you can kind of cross that off too. We don't really care about those. The vertebral foramen, this is the hole, right, through which your spinal cord goes. Okay, in the next slide, and you are going to turn the page again to page 16 in your new notes, and we're going to look at different kinds of vertebra. Oh, I lied. Before that, oh yeah, we'll get there. Okay, before that, this is another picture. This is so cool. I like this one. That's why I put it in here. So here's your intervertebral discs. And this is showing like how the connections to your spinous processes attach to ligaments that keep your spine in place, right? So you have this ligament right here that runs all the way down the front of the body of your spine. So this is toward the front of you, right? And there's another one back here, the ligamentum flavum. You don't have to know any of these, but oh no, that's not it. This is the posterior longitudinal ligament. So this goes down the back of the body, right? Then you have another one right here, which comes down in front of the spinous processes, right? So that's right behind where your spinal column goes. So your spinal cord is going to run down through here. Okay, there's no hole here. This is the body. This is what supports you. Your spinal cord runs down through here. And then back here, you have all of these ligaments that attach the spinous processes together. This right here is, wait, where am I? Lost. This is a joint. This has this funny name. I can't even say it. This right here would be where your superior articular process is, right? And this right here at this bottom, this is the inferior articular process of the vertebra above it. So where the two vertebrae articulate, right there, superior articular process, inferior articular process. And then you have, so these are between the two, each spinous process. And then back here you have one more supraspinous ligament that just connects all of your spinous processes right there and keeps all of your vertebrae right in place. Very cool. Okay, next slide. Okay, let's look at each of the kinds of vertebrae separately, and we'll look at details. So this is actually two vertebra. This one right here is the atlas, okay, and this odontoid process is actually the vertebra underneath, okay. So you can have to kind of make out the two vertebra. So this is the C1, and this one underneath it here is C2. This, I'm going to write now, these right here, right? I'm looking at my notes also. This is the articulation with the, if you remember, the occipital condyles. Occipital condyles of the skull. Condyles of the skull. So those two places right there is literally like where your head sits on your vertebra of the skull. Sit there. Another thing to note is that there has no body. So the atlas has no body. So that's one thing. No body. Like this does. Or even like here, there's a small body of the axis. That's why this is called the body of the axis. The axis also has a special feature that's different from most of your vertebra, and that's this thing here. It's called the odontoid process, or the dens, and it's like a little nub that sits up, and it's literally what the atlas here and your skull rotates on is this dens. So it pivots. That's like a pivot point. Okay, so those two are special. The rest of your cervical vertebra are considered sort of typical cervical vertebra. And the special thing about them is that they have a foramen in here. So anytime you see an extra hole, right, what's called a transverse foramen, that's the hole through which the arteries of your vertebra pass through to the brain. Okay, so anytime you see these, that's how you know that that's a cervical vertebra. Okay. Letter C here, we're looking at the thoracic vertebra. There are 12 of these, and they're all fairly typical. One thing that they have, all of them different, is your thoracic vertebra connect to your ribs, and so this is a facet articulation point with your ribs. This is actually kind of where the ribs attach. They're not sutured there, of course, but they articulate with your vertebra there. And then they kind of, if you kind of think of it like this, it kind of also runs along here. So this is another facet up here, another articulating point between your thoracic vertebra and your ribs. The spinous process is going down, and that's because if you look here, right, all of your thoracic vertebra are sort of curved out this way, which is why they're going down. And then D is your lumbar vertebra. Notice that the body is super big. Notice also that the spinous processes are getting super big as opposed to the spinous process in your thoracic vertebra. So everything's like big and bulky and carrying all of your weight. Okay? So that's it. There is some stuff in your book about the sacrum and the coccyx. We're not going to worry about the details of those, except that your sacrum is 5 fused vertebra and your coccyx is 4 fused vertebra. Okay, so that's the vertebral notes, and I will see you in class tomorrow.